Buprenorphine, a semi-synthetic opioid medication, has gained significant attention in the field of addiction treatment and pain management. As we delve into the intricacies of this remarkable substance, we will explore its common applications, benefits, potential side effects, dosage guidelines, and associated risks. By understanding the nuances of buprenorphine, we can better appreciate its role in alleviating suffering and promoting overall well-being. Common applications of buprenorphine. Buprenorphine finds its primary application in the treatment of opioid use disorder, OUD, a condition characterized by the compulsive use of opioids, leading to physical and psychological dependence. Approved by the Food and Drug Administration, FDA, for this purpose, buprenorphine is used in medication-assisted treatment (MAT) programs, often combined with counseling and behavioral therapies. This comprehensive approach aims to mitigate the debilitating effects of opioid addiction and support individuals on their journey to recovery. Additionally, buprenorphine is utilized for the management of moderate to severe pain, particularly in cases where traditional opioid analgesics are contraindicated or pose a higher risk of misuse. Its unique pharmacological properties make it a valuable option for pain relief while minimizing the potential for abuse and dependence. Benefits of using buprenorphine. One of the primary advantages of buprenorphine lies in its partial agonist properties, meaning it binds to opioid receptors in the brain but produces a ceiling effect, limiting its potential for respiratory depression and overdose. This characteristic makes buprenorphine a safer alternative to full opioid agonists, reducing the risk of life-threatening complications. Furthermore, buprenorphine has a lower risk of physical dependence compared to other opioid medications, making it easier for individuals to discontinue treatment if necessary. Its long-acting nature also allows for less frequent dosing, improving adherence and convenience for patients. In the realm of pain management, buprenorphine offers effective relief while minimizing the risk of misuse and addiction associated with traditional opioid analgesics. This benefit is particularly valuable for individuals with a history of substance abuse or those at high risk for developing opioid use disorder. Potential side effects of buprenorphine. Like any medication, buprenorphine carries the potential for side effects. Common side effects may include nausea and vomiting, headache, sweating, constipation, dizziness, drowsiness. It is essential to note that the severity and frequency of these side effects can vary among individuals, and some may experience milder or more severe reactions. Consulting with a healthcare professional is crucial to manage and mitigate any adverse effects. Dosage guidelines for buprenorphine. The appropriate dosage of buprenorphine is determined by several factors, including the individual's medical history, the severity of their condition, and any concurrent medications they may be taking. Healthcare professionals carefully assess each patient's unique circumstances to establish the optimal dosage regimen. In the treatment of opioid use disorder, buprenorphine is typically initiated at a low dose and gradually increased until the desired therapeutic effect is achieved. This approach helps minimize the risk of precipitated withdrawal symptoms and ensures a smooth transition to the medication. For pain management, the dosage is tailored to the individual's pain levels and response to the medication. Careful monitoring and adjustments may be necessary to maintain effective pain relief while minimizing potential side effects. Risks associated with buprenorphine use. While buprenorphine offers several benefits, it is essential to acknowledge and mitigate potential risks associated with its use. These risks may include respiratory depression, particularly when combined with other central nervous system depressants. Potential for misuse and diversion, although the risk is lower compared to full opioid agonists. Precipitated withdrawal symptoms if initiated too soon after the last opioid use. Interactions with other medications, which may alter the efficacy or safety profile of buprenorphine. Proper medical supervision, adherence to prescribed dosages, and open communication with healthcare providers are crucial to minimize these risks and ensure the safe and effective use of buprenorphine. Buprenorphine versus other opioid medications. Buprenorphine distinguishes itself from traditional opioid medications in several ways. Partial agonist properties. Unlike full opioid agonists, buprenorphine exhibits a ceiling effect, limiting its potential for respiratory depression and overdose. Lower risk of physical dependence. Buprenorphine is associated with a lower risk of physical dependence compared to other opioid medications, making it easier to discontinue treatment if necessary. Longer duration of action. Buprenorphine has a longer duration of action, allowing for less frequent dosing and improved adherence. Reduced risk of misuse. While the risk of misuse still exists, buprenorphine is generally considered to have a lower potential for abuse compared to full opioid agonists. These unique characteristics make buprenorphine a valuable alternative in the treatment of opioid use disorder and pain management, offering a balance between efficacy and safety. How buprenorphine works in the body. Buprenorphine exerts its effects by binding to opioid receptors in the brain and central nervous system. As a partial agonist, it activates these receptors to a certain degree, producing analgesic, pain-relieving, and anti-addictive effects. However, due to its unique pharmacological properties, buprenorphine exhibits a ceiling effect, meaning that increasing the dose beyond a certain point does not lead to a corresponding increase in its effects. This characteristic contributes to buprenorphine's safety profile, as it reduces the risk of respiratory depression and overdose compared to full opioid agonists. Additionally, buprenorphine has a high affinity for opioid receptors, which means it can displace other opioids from these receptors, potentially reducing cravings and withdrawal symptoms in individuals with opioid use disorder. Buprenorphine treatment options and resources. Individuals seeking treatment for opioid use disorder or pain management with buprenorphine have several options available. Outpatient treatment programs. Many outpatient clinics and treatment centers offer buprenorphine-based medication-assisted treatment (MAT) programs, combining medication with counseling and behavioral therapies. Office-based opioid treatment (OBOT). Qualified healthcare providers, such as physicians and nurse practitioners, can prescribe buprenorphine for the treatment of opioid use disorder in an office-based setting. Inpatient rehabilitation centers. Some inpatient rehabilitation facilities incorporate buprenorphine into their comprehensive treatment plans for opioid addiction. Pain management clinics. For individuals seeking pain relief, buprenorphine may be prescribed by pain management specialists or other qualified healthcare providers. It is essential to consult with healthcare professionals and explore the available resources in your area to determine the most appropriate treatment plan and support system. Conclusion. Buprenorphine has emerged as a valuable tool in the fight against opioid use disorder and the management of moderate to severe pain. Its unique pharmacological properties, including its partial agonist nature and ceiling effect, contribute to its safety profile and reduced risk of respiratory depression and overdose. While buprenorphine offers numerous benefits, it is crucial to acknowledge and mitigate potential side effects and risks through proper medical supervision and adherence to prescribed dosages. By understanding the nuances of buprenorphine and its appropriate use, individuals can embark on a journey towards recovery or effective pain management while minimizing the risks associated with traditional opioid medications. If you or someone you know is struggling with opioid use disorder or seeking effective pain management solutions, we encourage you to explore the available treatment options and resources in your area. Consult with qualified healthcare professionals to determine if buprenorphine is the right choice for your unique circumstances. Remember, recovery and relief are within reach, and taking the first step towards a healthier life is a courageous act.